First, a little bit of background. I work in relation to the implementation of the Social Services and Wellbeing Act 2014. Now, that Act is scheduled to be commenced on the 6th of April this year. And over the last year or so, colleagues and I have been carrying out a great deal of work in relation to supporting that implementation via the development of regulations and code of practice to explain the detail of the various statutory duties contained within that Act. And that Act, I think, is truly transformational in relation to the way care and support services in Wales will be delivered. And there are a number of key principles which underpin that piece of legislation. All of those principles are contained within and reflected in the population assessment, which I'll go on to speak about shortly. But if I just quickly take you through some of those key principles. The Act is all about promoting the well-being of people with care and support needs. That's one of the key principles. It's about promoting well-being of the individual. Also important within the Act is the key principle of prevention. Preventative services are a necessity. If we want to make social services in Wales sustainable and fit for the future, there has to be a preventative angle to it. In addition to that, integration of health and social services is also a key objective of the Minister for Health and Social Services in Wales and is reflected in various stages throughout this Act. Finally, the principle of co-production, the principle that social care shouldn't be something that is done to people, it is something that is done with them as equal partners in that process. And I think those are the sort of key principles which underpin this piece of legislation. Now, one of the key sections of the Act, one of the key provisions of this Act is Section 14. Section 14 requires health and social services to jointly undertake a population assessment of the care and support needs of the local area. So that has to identify the extent of care and support needs of the local population and the extent of the support needs of carers within that local population. And then it goes a bit further than that. It goes a bit further than previous population assessments, I think, and it also requires local authorities and local health boards to jointly identify the range and level of services necessary to meet those care and support needs identified, and the range and level of preventative services necessary. So as well as starting to think about, okay, what are the care and support needs of the local area, the population assessment requirement also requires an assessment of what are the range and level of services necessary to meet that need in a preventative way. Because the next key provision in the Act, I think, is Section 15. And Section 15, for the first time, places a statutory duty on local authorities to provide preventative services. Now, we know already that there are lots of good examples of preventative services being provided across local authorities in Wales, yes. But what this Act seeks to do is it seeks to move away from saying that that's good practice. It seeks to move that to being a statutory requirement to take a preventative approach to prevent or delay the development of people's care and support needs. And so, the reason that I talk about Section 15 as well as Section 14, the assessment, is it's entirely linked to the population assessment, because we're saying that we don't define exactly what a preventative service is in the Act. We don't say that you have to do this and therefore you've discharged your duty. We set out various purposes for preventative services, but we don't define specifically what a preventative service will look like. That's because the preventative service will look like what you need to do as the result of the Section 14 population assessment. The population assessment will steer you in terms of identifying how you will meet need preventatively. So the preventative service is what you identify you need to do yourselves. Now, generally, the population assessment will be a clear and specific evidence base to inform the range of care and support services that must be delivered. Now, rather than saying that services must be identified in terms of, well, we did this last year and we think that worked, we're not sure what we're going to do this year, we are now requiring there to be a clear and specific evidence base to drive the delivery of all care and support services. It will inform a range of resource and budgetary decisions. It will inform a range of services. We also expect it to inform not just services provided by health and social services, but potentially services provided by other partners, such as the voluntary sector or even private sector providers, because it will be a general identification of care and support services and what needs to happen across partners to deliver those services. So, for example, in the code of practice that we've developed to support the population assessment, we set out that it will be a meaningful tool to inform the local health board's integrated medium-term plan. It won't be the be-all and end-all, it won't do everything for that, but it is a clear and specific evidence base that can be used and taken forward to inform that integrated medium-term plan. And the reason we're here today is to talk about the link between this population assessment and the assessment of well-being required by the Wellbeing of Future Generations Act. Because what the Welsh Government has done is we have provided a clear statutory link between the population assessment required by the Social Services Act and the well-being assessment required by the Wellbeing of Future Generations Act, so that population assessment has to be taken into account as part of that overarching wide-ranging assessment of well-being required by the Wellbeing of Future Generations Act. It is a key, it will form part of it, but it's not the be-all and end-all of that either. That's a much wider assessment relating to well-being more generally, which Claire will go on to talk about shortly. So what we did in the Welsh Government is we formed a wide-ranging technical group to inform the development of our regulations and our code of practice, to really get a sense of what stakeholders wanted and what they thought would be effective. And as a result of that, my team and I delivered and developed regulations and code of practice to set out a bit more detail about how we expect that Section 14 requirement to undertake a population assessment to be produced. So what we said is, as a result of regulations, we are now saying that after undertaking this population assessment, there needs to be a population assessment report produced and published. The first population assessed report needs to be published in April 2017, so one year after implementation of the Social Services Act. That population assessment report has to be published, and a copy of it has to be sent to Welsh ministers at the Welsh Government. We do say then we expect the population assessment report to follow a local government electoral cycle, so we expect one every local government electoral cycle. But we identify that that population assessment report has to be reviewed at least once during that local government electoral cycle. More if you want to, but it has to be reviewed at least once to identify if care and support needs change. What we are saying is we're not expecting this population assessment report to be a snapshot. It's not a picture of now in terms of what are the care and support needs of our area at this moment of going to publication. It's meant to be forward planning and identifying what we expect the care and support needs to be for the period of the population assessment report. And whilst you can do that to a certain extent, obviously there may be a need to review it, so therefore we factored into that review, we factored into the requirement for review into the regulations. Finally, and I think key, is point four on my slide at the top there, is the fact that we don't want this population assessment report to be a dry analytical exercise undertaken by statisticians in a room. Now, I have to be careful how I describe analytical experts this time, because I'm aware of the fact my audience might appreciate that sort of approach. But in this instance, what we are saying is this population assessment has to be a clear mix of quantitative and qualitative evidence. It's not just about analysing statistics. Yes, that played a clear part in it, and there is a clear need to identify clear information sources in terms of identifying your population needs, but there has to be a qualitative evidence to it as well. And in keeping with the principle I've already spoken about the need for co-production and involving citizens, we say in the regulations that local authorities and health boards have to develop a process for engaging with citizens so that they can have their say in relation to identifying what they think the care and support needs of an area are and what they think the range and level of services necessary to meet those needs are. So there is a co-produced assessment of those needs. And in addition to engagement with citizens, we also say that there's a need to engage with other service users. So there is a need for local authorities and local health boards to engage with other service providers, such as the third sector, such as private providers as well in the area. Again, so that tool, that population assessment report, can be something that can inform the range of services, not just the local authorities' own and the health board's own services, but the range of care and support services in the main. Finally, in terms of the regulations, Part 9 of the Social Services Act provides for partnership working, provides for the integration of health and social services. So what we are saying is, whereas the Act originally said that we expected there to be 22 population assessment reports undertaken, what we've done by the regulations is we've required partnership arrangements to be put in place so that we will have population assessment reports which are combined at the health board level. So rather than having the 22 times, we're expecting a partnership arrangement via the regional partnership boards, which I'll go on to talk about in a minute, to put in place partnership working so that population assessment reports are combined, so that 7 combined population assessments are produced on the health board footprint. So you would have the local health board and the various number of local authorities within that health board area come together to produce a combined assessment report. Now, most of the detail in terms of the requirements for the population assessment are set out within the regulations and within the primary legislation itself, but there is a code of practice in relation to Part 2 of the Act generally, which has been published, and that sets out a lot more detail in terms of how we expect the population assessment to be produced. It articulates the technical legal stuff contained within the Act, it articulates the stuff within the regulations, and it contains some more information generally. So, for example, we set out within the code of practice that we expect population assessment reports to be set out around 8 core themes, and those core themes are set out there. That's not an exclusive list. If in undertaking a population assessment, partners identify that there are more things they want to cover and they want to identify other areas and focus down in different areas, they can do. But that is a core minimum requirement, that population assessment reports are based around those 8 core themes. And what we say is that in a population assessment report, in a combined population assessment report on the health board level, we expect to be able to look at the care and support needs across the wider health board region, but also be able to drill down to identify, okay, if you're looking at, say, Gwent, for example, you can identify what the care and support needs are across the Aneurin, Bevan or Gwent health board area, but what are the specific areas in relation to Newport? What are the specific areas in relation to Blaine and Gwent? So we are expecting to be able to drill down within those core themes to identify specific care and support needs for each of those various areas. We undertook a public consultation on the Code of Practice and on the regulations, and as a result of that, we also identified the need to develop some further support and further aid for practitioners in terms of the process for undertaking that population assessment. So what we have done is we have commissioned the Social Services Improvement Agency and Public Health Wales to develop a toolkit to go alongside the statutory Code of Practice. And that toolkit will do lots of things and provide further help and support in relation to how local authorities and health boards should together undertake this population assessment. I'm very pleased to see that Tony and Rebecca are here today from SSIA to have a workshop on that later on today, and they'll be able to explain the toolkit much better than I can. But essentially, I think some of the key components of that toolkit is it will contain a data catalogue, not a specific data list that you have to use, but a data catalogue in relation to some of the sources of information that practitioners might wish to use in terms of informing their population assessment report. And it will also have sort of helpful information in relation to how stakeholders can meaningfully engage with citizens, how they can meaningfully engage with other partners as well. And it is just a toolkit to go alongside and provide some further help in relation to what that population assessment should look like and how it should be undertaken. Okay, I don't know how I'm doing for time. One of the things I'm keen to stress here today is that I'm aware of the fact that there is a requirement for a wellbeing assessment contained within the Wellbeing of Future Generations Act, and that those two processes do go on in parallel, and there is indeed a statutory link so that the population assessment by the Social Services Act must feed into and inform the wider wellbeing assessment. But this population assessment of care and support needs is a specific thing. It is there for a particular reason. It is there to drive and improve care and support services specifically in a local area. It will be more detailed, I suspect, than the information contained in relation to the wider wellbeing plan. And one of the things I think you'll do that is very important is that I set out at the start of my presentation that the integration of health and social services is a key part of the Welsh Government's agenda for care and support needs. And therefore, also as a result of the Social Services Act, we are providing for new regional partnership boards. These regional partnership boards will really be the engine of integration. They won't just be a planning board, they will be a board to make decisions on practical uses and practical application of integration of health and social services within the area. And we've set out in regulations the requirement for there to be 7 regional partnership boards, again on the health board footprint. And you'll notice that again, those partnership boards are on the same footprint that we are now requiring for there to be a combined population assessment. So the population assessment report will really drive the agenda of these regional partnership boards. Their duty, as contained within the regulations, is specifically to respond to the outcome of that population assessment. It is the starting gun in relation to what we expect these partnership boards to do. The partnership boards will assess, they will plan, and then they will deliver. They are not just a planning vehicle. They are there to be driven and make use of and convert the information contained within the population assessment into practical, effective and efficient care and support services across their area. And just a little bit more detail in terms of the regional partnership boards. The regulations in relation to regional partnership boards set out that these again will be a fairly broad church in relation to delivering services. They will be a mixture of senior officials from within health boards and from within social services departments, but they will also contain an elected representative, and again they are also required to contain citizens. There is a requirement that people are involved in these regional partnership boards to make sure you have that co-produced element of the way care and support services are delivered. And again, that isn't the be-all and end-all. That is just the minimum list. Local regional partnership boards can contain other representatives if they so wish to do so. And again, just to go through that, the aims of the partnership arrangements are to improve the care and support, ensuring people have more say and control. And again, in there you'll see reference to the fact that they are there to respond to the population assessment as required by Section 14 of the Act. Okay, and that's me done, I think. That was about 50 minutes. I'll hand you over to Claire.